Today we will be presenting emergency tourniquet responses to arterial gunshot wounds.
Parker, 1 second.
Sorry.
I need to go back and start something. All right, you guys are good to go.
Today we will be presenting on emergency tourniquet responses to arterial gunshot wounds.
Presenters include Rosan East, Parker Clemmings, Melanie Angulo, and Eric Munoz.
Essential question: how can tourniquets be used as an emergency response tool when treating arterial gunshot wounds in pre-hospital environments? In our presentation, we'll highlight the benefits of using tourniquets as an emergency response tool. We'll focus on the effect that handguns have on familial arterial pressure. And lastly, we'll conclude with our call to action, stressing the importance of tourniquet use in emergency medical practice and explain why it's essential to teach civilians to treat and respond to gunshot wounds.
A 24-year-old female was shot in the leg by a handgun, impacting the femoral artery, resulting in a rupture and hemorrhaging. You find yourself in front of her after calling 911 and an ambulance 5 minutes away. What would you do?
To understand how the blood flows, you need to know that there are 3 types of vessels: arteries, capillaries, and veins. These vessels create pressure within the body that are read as systolic and diastolic pressures. A normal blood pressure is read as 120/80. Blood loss or extreme blood loss is referred to as hemorrhaged.
There are 4 types of gun wounds: penetrating, perforating, re-entry, and tangential injuries. These injuries can be life-threatening, especially if the bullet ruptures a major artery. The femoral artery is a large vessel that provides oxygenated blood to lower limbs. If the artery is severed, a person can bleed to death within 5 minutes. To stop hemorrhage, surgery must be performed, which may be difficult if the wound is near the groin. If not, rapid blood loss will lead to a decrease in blood pressure, temperature, oxygen to the brain, and eventually death.
When someone is bleeding, applied pressure slows blood flow and allow clots to form. However, when major arteries are severed, tourniquets are critical to prevent life-threatening hemorrhaging. Tourniquets are used once direct pressure fails to stop the bleeding. Its goal is to restrict the blood flow to the limb in efforts to prevent further hemorrhaging and death. Tourniquets are applied above the wound and are made using a cloth and a windlass, which are used to tighten the tourniquet. Time is essential when applying a tourniquet, since adults can bleed to death within minutes, and leaving it on for too long can lead to limb loss. There are 5 main commercial tourniquets. Such tourniquets all vary in width and have unique features that apply to specific wounds.
Now we will explain to you how to apply a tourniquet. You will have to position the tourniquet where it's closest to the heart. For instance, if the injury is below the knee or elbow, you will need to tie the tourniquet above the joint. It'll have to be placed at least 2 to 3 inches away from the wound. Then you'll clip the sides of the tourniquet and pull the end of the strap in order to tighten it as much as you can, as if you are tying a belt. You will begin to twist the windlass bar in one direction in order for the pressure to increase so the bleeding stops. After that, you'll use the windlass clip to secure the bar so that it does not untwist. If the tourniquet doesn't stop the bleeding, you can apply a second tourniquet above the first. Above meaning that it should be closer to the torso. Then you'll note the time. It's very important to note the time the tourniquet was applied for medical professionals to determine the best follow-up procedures.
Some health professionals disagree with the use of tourniquets since they increase the chances of necrosis and limb loss, but others still deem tourniquets a useful tool in emergency situations. Military use of tourniquets have seen success in multiple studies confirming their efficacy in pre-hospital settings. They can be useful in rural areas with delayed responses and mass casualty events. However, some pre-hospital providers have identified issues with the practice and believe that there's still room for improvement.
our call to action. We believe that tourniquets should be used as a standardized practice in emergency medical response. In the last 5 years, there have been at least 29 mass shootings with 4 or more casualties. Some cities have even agreed to take additional emergency precautions and use techniques like tourniquets to avoid civilian death. Gun violence is a public health crisis that disproportionately affects Black men and women. Cities must teach citizens how to respond to gunshot wound victims, especially in communities that experience delayed emergency response times or are far from local hospitals. Ujima Medics is a leading initiative that takes place in Chicago, Illinois. This medical practice teaches civilians how to treat gunshot wounds and to give victims psychological support. It is comprised of volunteer medical professionals and community members and offers free and low-cost workshops. Until we develop successful interventions that mitigate the effect of gun violence, we must use necessary emergency responses such as tourniquets to save lives.
Thank you for listening to our presentation. Please click on the link below to access our resources.